Hi, good evening, friends. This is Dr. Chetna Jain. I'm director at the Cloud9 Hospital, which is a specialized hospital for the maternity. So, today we are going to talk about what happens after delivery, especially to the what is Lochia. Now, Lukya is the postpartum vaginal discharge or the bleeding. Now, initially, it may last for up to 40 to 50 days and sometimes a little more. So what happens is after the delivery, there are some remnants of placenta, blood, membrane, fetal tissue, vernix, and other things here. All this is there inside. Now, this is slowly shed over time, and this is what is known as Lukya. Nowadays, in cesarean, it is a little less because you open the uterus and clean it completely. However, in normal delivery, it may last longer. So typically, the Lukya is initially red in color, and it's quite heavy for the initial 4 5 days. Then it gets slightly paler, yellowish over the next few days, and finally it turns into a whitish pinkish discharge, which stays for a long time, and irregular spotting and bleeding will continue along with that. This will in all take about 40 days, but sometimes a little more. Now, typically, this is non-smelly, non-itchy, and should not cause any bad odor. But if you think that it is smelling bad, or you're running fever, or day by day the discharge is becoming more smelly, then you should get examined and see that there is no problem, that there is no infection, that there is nothing inside, and that all is clean, and why you're having all this. So women who have problems will run fever, will have foul smelling discharge coming from below. They might have irritation in the vagina, difficulty in passing urine, and so on. So when it happens like that, you must get in touch with your treating doctor, the one who delivered you should go back. They will examine and figure out what could be the cause. There should not be any infection after the delivery, and any infection in the after the delivery can be seen by doing a culture of urine, vaginal culture, or a blood culture or a blood test like CBC. So all this can identify if there is any problem. So what happens in when the lochia is more, you need to wear the maternity pads. As it slowly fades away, you can come back to regular pads. But the recommendation is always wear cotton sanitary napkins because the skin around gets very moist and it starts showing signs of fungal infection and skin dermatitis if you wear the plastic ones or the synthetic ones over a long time. Women who had cesarean can easily wear the cervical cup or the menstrual cup so that the blood is collected inside and the surface remains dry. So that's a good thing. But those who have delivered vaginally will not be able to use it, and they should continue using the normal cotton sanitary napkin. And whenever possible, they should expose their private parts to air and sunlight in a private manner so that they don't the skin gets complete healing and it doesn't get infected. But a lot of times women will not have that kind of privacy in the house, as there are a lot of there's involvement of a lot of relatives and they would not allow all that. So in that scenario, what you can do is apply some Vaseline or the diaper rash cream to the part which comes in contact with the sanitary napkin to avoid any napkin rash there. So that helps. It is very soothing and comfortable, especially more so in summer and rainy season. The winter seasons are a little better. Coming on to other problems, we can talk now that there could be biggest major problem that we see is the breast engorgement. Now, women tend to neglect it or ignore it. They think, okay, next time when they will feed the baby, it will go, and the third time it will go, and they keep on retaining the milk in the breast, and finally it turns into a lump. The ducts they get completely blocked, and even on suction or manual evacuation, they don't open up. It doesn't open up by even baby sucking the breast. And finally, if there is pus or fever, then we will have to stop lactation for the woman to feed. So that becomes very challenging for the mother, for the baby, and for the treating doctor. So my request to all of you is, if you anytime examine your breast and figure out a lump in the breast, then you must express it. Keep on expressing till the time the breast is completely devoid of lumps. So this breast like that should be examined after the breastfeed. So every time you feed the baby, you must feed on one single breast, examine the breast after the feed and see there is no lump, and there is any lump which is remaining after the feed must be expressed manually till the time it's completely clear, and you can wait and see what happens to the next breast after the next feed. So now this is all about the Lukya that we were talking. Then episiotomy is the cut which is given at the time of normal delivery, and then it is stitched up. So typically the pain starts getting less and less over time. By the end of 4 weeks, the episiotomy is completely healed. The stitches are shed. They are not removed. They fall off on their own. And that's why after a month, we call the patients to re-examine and see whether the stitches are completely healed and whether they are fit to resume their sexual life. So it is very important to get examined by the end of 4 weeks. At the time, any abnormality in the lochia will also be noticed, if at all. So majority of the women are fine. Typically, how you can understand that episiotomy is good or no is if at any time you find any swelling, any abnormally increased pain, if it is gradually increasing, if you think there is a pulsatile pain, if you think there is a throbbing pain, you think there is a constant pain which is not going away even with painkillers, with hot fermentation, then probably you need to see the doctor to figure out that there is no infection in the episiotomy. Mostly infections are not seen because the delivery is done with disposable instruments and the wraps. But if you have a great tendency to infection and if you think there is infection, please see the doctor. The earliest sign is infection. The delayed sign could be first discharge or the episiotomy opening up. The episiotomy can also open if you open your legs wide and strain too much and you don't avoid constipation, so the stitches might cut through if your skin is very fragile. This may happen to a few patients, but most of the patients they tolerate all this very well. Now we are here to discuss any questions that you have related to Lochia, related to postpartum care, related to gynecology, or even obstetrics. If you have any questions, the forum is open. So, what should I, just a minute, when should I worry about Lochia? So, Lochia is a common phenomenon. You should only worry if it is not going away after 60 days, if it is smelly, if it is itchy, if it is too much, even after 10 or 15 days of delivery, that you're passing clots, then you must see the doctor. Otherwise, there's no problem. So it should not be smelly, too heavy, or too itchy. Is it normal for postpartum bleeding to stop and start again? Yes. This is seen by many. And what happens is the bleeding stops. It happens for a few days, then it stops. So what happens? The lining is healed already, and now the estrogen and progesterone levels are very low. So the lining starts shedding again intermittently. So you can see some intermittent spotting or bleeding, and it heals and again it spots. So this is very common, and typically all of it stops by the end of 2 months. It's very rare to have it after that. How long does Lukya last? So typically the Lukya would last for 40 days, but sometimes it may last for up to 60 days. If Lukya is smelling so bad, can you please suggest what should I do? first of all, you should see the doctor who delivered you to rule out anything and that there are no pieces, there is no infection. And after that, if all is clear, then you will probably be given antibiotic. But there's a possibility that the normal smell of Lochia is you are feeling bad, but it could be just a normal smell. So a specialist only can tell if it is a bad odor or no, but if it is too bad, you will also notice. So the most common reason is you're keeping your napkin on for a very, very long time. So typically, the no napkin should be left alone for more than 4 hours. If you leave your napkin there for more than 4 hours, there could be significant smell. So thank you for coming in today. And if you have any suggestions, do write to us. Otherwise, we'll be coming back next week with a new topic. Thank you so much. Bye bye.